San Mateo County's population is about 735,000, and you may know that we're one of the most affluent communities in the nation.
But we also have a lot of health inequities.
The disparities between the haves and the have-nots are very significant in this county. Local public health systems like ours can be powerful levers for change in addressing the root causes of poor health, basically through prevention and policy change. One of the core beliefs that we have that really drives this planning is that the people who are experiencing poor health are the best key informants for what the strategies are for addressing these problems.
Every year in the fall, we put out an open call for proposals. Community groups tell us what you're doing that helps advance health equity. San Mateo Foster City School District that came to us and said, we've heard about something called restorative practices and we really want to bring that opportunity to our district.
Kids who are from low socioeconomic backgrounds can be disproportionately identified for discipline.
The traditional model is just to send kids to the office, and lots of times that may end up in a suspension. It's proven that students don't really learn anything from that sort of discipline. Restorative practices is another way to create connections and community and that sort of thing so that students feel comfortable talking to teachers and feeling like they have somebody to go to.
So our project for restorative practices is focused on school connectedness. Kids who have a high degree of school connectedness are more likely to go to school. They're more likely to graduate. And so these things are going to lead to better life and better health outcomes for those students as well.
They've had enormous positive impacts in just building a culture of health in Foster City School District.
One of the other things I think really contributes favorably to our work is that we have structures to engage young people in the development of the solutions around this.
Leadership opportunity is also a really critical, important aspect of achieving health equity in the future. The Youth Commission is a way where youth have a formal voice in the civic infrastructure of San Mateo County, as any other commission does.
The Youth Commission is made up of 25 youth from across the county. They are officially appointed by the Board of Supervisors to advise on youth-related policy.
They have first-hand experience as to how decisions are made at a county level, and they can actually shape and influence those decisions as well. Oftentimes, young people actually have the solutions. They're just not given that platform or opportunity to provide that, and their stories and their experiences are actually a way of showing their expertise.
What we've been able to do is engage those young people in some of the key policy decisions that ultimately really impact health.
Having the youth in a place where they're providing input into the decisions that impact their future is enormous.
In this community, we really need the leaders of the future to come from among these ranks, and we need them to be interested in running for elected office. We have cities that are making decisions in their local policy that really support health, and it's pretty terrific to see.